don't work like they're supposed to. So you're going to be hearing a lot about cell signaling technology, not just from what we are discussing here at BioLimitless, but you're going to be hearing that in the health and wellness space. Why? Because it's the truth. People are moving towards it, and so now doctors are starting to talk about it. And the amazing thing about cell signaling technology is we can actually stimulate those cells. There are multiple chemicals in the body that we lose the ability to produce as we get older. How many of you could eat whatever you wanted to eat and all of a sudden you hit 30, 40, or 50, now you get heartburn, bloatiness, gas, distension, whatever? That's because of one or two reasons. You've lost the production of enzymes in your body. Enzymes break down food so that they can digest and be absorbed in the cells, and they tell other cells what to do. Well, that's a cell signaling technology that you can lose. We're bringing that to the delivery system for you guys. The second thing that people lose as they get older, as we get older, is we lose the ability to produce the right bacteria inside the GI tract. We're going to get into that in just a moment. The third thing is we start losing stem cell and exosome function. Well, I told you that we have a product we're going to be launching at the global launch in 6 months that is the first FDA-approved oral consumption pill for exosomes. That by itself is an absolute game changer. And then there's the conversation about something called peptides. How many of you ever heard of peptides before? Well, you know, peptides, I giggle about this because we've been using peptides in our private practice now for almost 2 decades. It's not a new thing. Peptides have been around for a long time. But just like, you know, like social media does, it makes things popular when people are looking for solutions. How many of you guys know that the reason why peptides are popular now is because the system has failed and people are desperately trying to figure out a product or a solution to solve the problem of the failed system? That's what that is. That's all that that is. And the problem, the solution is not peptides. The solution is not stem cells. The solution is not gut bacteria. It's not more vitamins. It's not the latest Vitavita Vegemin product. It's a system to understand how your health works and then a process for you to implement that. And it's different for every individual. Once we understand that and grab onto that, that's the breakthrough that we all can have. Now, cell signaling is a really interesting conversation. So what I'd like to do before I talk about our cell signaling technology is there's a video that we have on cells function. I want you to look at this because this is a video about producing ATP, which is energy. How many of y'all know people who they're get up and go, got up and went, they don't have energy anymore? It's not because you're old, it's because your cells aren't doing this anymore. This is one of the key components to cell signaling technology. So let's watch that video first.
All life on Earth depends on this tiny, energetic molecule, adenosine triphosphate, or ATP. ATP drives biochemical activity inside your living cells and is a key building block of DNA and RNA. Generating ATP for your living cells are mitochondria, electrochemical batteries that converts energy from the food you eat and oxygen from the air you breathe into ATP. So where does your ATP come from? Deep inside your mitochondria, rows of molecular motors generate ATP, the molecule essential to all life on Earth. Enzymes bring together reactants to form a chemical bond, converting mechanical energy into chemical energy. A ring of enzymes work in step, creating 3 molecules of ATP with each cycle. Inside the molecular motor, a rotating axle powers the sequence. The axle is attached to a rotary molecular motor, moved by the force of protons pushing from the other side of the membrane. A difference in proton concentration propels the molecular mechanism. Synthesis of ATP. ATP drives biochemical activity inside your living cells and is a key building block of DNA and RNA.
So I wanted to show you what cell signaling looks like in the body. That's literally a microscope of what's happening in your body. The cells have to be signaled. They have to move around to wake up the body, to grab those nutrients and put it into play. Well, folks, we have technology in the use of peptides. We put a formula together that has been very beneficial in causing cells to signal, in reducing inflammation, and telling the tissues to go back to work. I want to share this technology with you, but before we do that, let's play a little video about our product, Cell Signaling Formula, and then I'll come back and talk a little bit about that product.
Many of us experience constant fatigue, slow recovery, persistent inflammation, and hormonal imbalances as we age. Starting around the age of 30, our cellular signaling efficiency begins to decline, which leads to slower healing, weakened immunity, and accelerated aging. Without proper signaling, our bodies struggle with tissue repair, hormone production, and maintaining our overall health and vitality, among other often experienced symptoms. And as we know, treating these symptoms isn't ever going to be enough. We can, however, help address a root cause by improving cell signaling and reinvigorating our bodies to work more efficiently for us. Our bodies rely on trillions of cells communicating and working together effectively to perform many of our essential functions. Now, imagine a construction site where the workers, in our case enzymes, peptides, your microbiome and stem cells, are no longer receiving proper instruction, despite having all the necessary materials to build, such as vitamins, minerals, nutrients, fats, proteins and carbs. Nothing gets built. An ideal state of health means having all these workers and materials in sync, leading to increased energy levels, improved tissue repair, balanced hormone production, stronger immunity, and more graceful aging, both outwardly and at the cellular level. But how do we achieve this ideal state? Many people choose the route of taking commercially prescribed peptides to help with cellular signaling. However, there are often significant downfalls. Megadosing with peptides, as seen with many doctor-prescribed injections, can make your receptors less efficient and may cause other side effects. Additionally, these treatments can be quite expensive, often costing hundreds to thousands of dollars per month or more, plus potential doctors' office fees. That's why we developed a better solution, BioLimitless's Cell Signaling Formula. Our unique delivery system contrasts with the injections of today's peptide drugs and allows you to microdose powerful peptides that provide a superior physiological response at a lower cost with less side effects. This advanced supplement features a powerful tripeptide complex, including Cmax, ipamorelin, and BPC-157, known for their remarkable abilities to enhance cognitive function, stimulate growth hormone release, and promote tissue healing, among others. Created using our globally patented phyto-microencapsulation technology, we can ensure these short-chain peptides are protected, survive the stomach acid, and reach the small intestine to be absorbed into the bloodstream. By using our cell signaling formula, you can improve cellular function, support healthy organs, optimize nutrient absorption and utilization, and boost your immunity, all while avoiding the pitfalls of traditional peptide treatments. Incorporating BioLimitless's cell signaling formula into your daily routine means you're not just treating symptoms, you're addressing a root cause of aging and cellular health decline. Experience the transformative power of optimized cellular function and take a proactive step towards a healthier, more vibrant life.
How cool is that? So let's talk a little bit about the formula, what's in it, how it works, etc. You'll be able to go later on the website, see more about this. We're going to be doing we've already have a tremendous amount of content that we've already pre-recorded for educational purposes for doctors, scientists, and et cetera to see, and then also for lay people as well. So look, this formula uses a tripeptide solution, which is, so 3 peptides we have in here, and the oral encapsulation technology allows us to get absorption of that into the small intestine, which will get it into the bloodstream. It helps people so they don't have to use the injections anymore. Now, you have to understand that there's a whole bunch of peptides that are out there. And so we're using specific peptides for specific reasons, especially the peptides that are what are considered GRAS, generally recognized as safe. And these peptides are nothing more than amino acids put together. You guys know what amino acids are? So it's literally like just a little chain of amino acids. Amino acids form together to make protein. So these amino acids come from plant-based and animal-based proteins. When they break down, they form this little chain. And this little chain is kind of like a code for the body. If I'm gonna write a code for a computer, it's got a specific algorithm for it. Well, that code goes into the body, and when you saw some of those red and green proteins attaching to the DNA, those are peptides to signal the cells to do work. So Cmax is a peptide. How many of you in here know about peptides or have used peptides before? Yeah? So they're really an amazing tool and very safe, just like all things, used in moderation are very safe. You know, you drink too much water, you're gonna drown, right? So too much of a good thing is a bad thing. We know that Cmax has cognitive enhancement principles for the brain. There's a tremendous amount of data and research that shows that it causes the brain to rewire and refire. Remember I showed you that heart rate variability brain scan before in a couple prior presentations where those areas were, you know, red, black, or problematic? That's low blood flow to those areas. That's an area of trauma. Well, Cmax can help get blood flow and circulation back into the brain, which is a very big deal considering the fact that most people have certain types of insulin resistance in their body, which causes the micro blood vessels in the brain to get narrowed and not allow that blood flow to get the brain to work. If the brain doesn't work, nothing works. You guys heard that from Dr. Porter. Cmax is also a BDNF producer, and it produces ATP, so it helps protect the brain. How many of you ever heard people say, man, I'm so stressed out, I keep forgetting things? You ever been in that position before? These are not senior moments, it's your brain not functioning like it's supposed to. You should never have those issues. So when we're stressed out, cortisol in the body gets produced, other chemicals, and our brain literally can turn into Swiss cheese. Well, if we have BDNF protectors, that protects the brain for that. Cmax has clinically shown to do that. Ipamorelin is a secregagogus peptide that helps the body produce something called growth hormone. Now, I don't know if you know much about growth hormone, but growth hormone really truly is the chemical of longevity. It's the chemical of anti-aging. It's the chemical of youth. It really truly is. If Ponce de Leon was looking for, something to really help people stay young, it was growth hormone. Now, I'm not a big fan of going and injecting yourself with growth hormone. I have some patients that do it. We prescribed it for certain conditions. But did you know that like 0.1 cc of growth hormone could be like $500 to $1,000 for just one shot for that? What if there was a safe, effective way that you could stimulate the pituitary without side effects and cause the body to improve growth hormone? Well, what does growth hormone do? It helps a lot with producing muscle mass in the body. Why is that a big issue? Well, the longevity studies have clearly proven to us that the thicker and stronger our muscles are moving into our later years of life, the happier, healthier that we are, and the less chances we have, fall and breaking hips and having chronic pain and inflammation. The more muscles you have, the healthier you are. We lose muscle production as we get older. How many of you know men, sometimes women, but usually this is a man problem? We get over the age of 30, we start losing our testosterone, and we start losing our peptide production. And we get this condition where our butt used to be big and plump and bubbly, and now we lose it. It's called no acetol syndrome. We get a belly and no acetol, right? That's a sign that your body's out of balance. There are physical indicators for that. Ipamorelin can help improve muscle mass. That not only helps us reduce pain, but it also helps our body absorb sugar and glucose, because the number one organ in the body that holds onto and pulls into the body sugars are the muscles. So you want to help reverse blood sugar issues, including diabetes, we got to have muscle mass to do that. Another peptide that's in here is called BPC-157, body protective composition peptide is the name of this. It's a 15-chain amino acid peptide. Cmax and ipamorelin are tiny. They're 5 and 7. That's why they're so easy to absorb into the GI tract. But BPC 157 is known as the Wolverine peptide. It's a nickname for that peptide. You know, the Wolverine just had a movie that came out again, right? Did you see that? And the reason why they call it the Wolverine peptide is because this helps heal cells on a cellular level. It actually comes from gastric tissues that our body produces to make this peptide. So this is a peptide that can help heal leaky gut, which leaky gut, you're going to hear about in a minute, is one of the plagues that's really tearing us up as a society. BBC 157 helps the body heal itself. We were at dinner one time after one of our events, and we were having dinner with a really interesting young man, and he says, "Doc, these peptides are so good, like if I cut my finger off, it's gonna grow back?" I said, "No, I never said that." So just for the record, okay, that's not the way it works. But it's amazing what this can do. I will tell you that I've personally used this on myself and with patients. If I've ever had an injury in my hip, my knee, my back, whatever, injecting into those areas and taking it orally can really truly speed up healing. We also put in here methylated B12 and methylated folic acid. Because some 70+% of the population has a gene imbalance called MTHFR, which doesn't allow you to methylate, these two nutrients can absolutely be a key to help reducing a lot of the problems that 75% of the population deals with. So that is a phenomenal formula. We put a couple amino acids in here as well so that we can improve blood flow and circulation. We wanted to give a calm intensity. I want you to feel something, but I don't want you to, this is not like a dopamine hit. You know, I want to improve your cell function. It's not like, you know, having a whole, you know, case of caffeine or something like that. And then we put cayenne pepper in here because cayenne pepper can help heal the gut and it moves the blood in the body. And many people have a lot of circulatory issues, especially in their fingers and their toes. They start to get neuropathies and they start to get issues with, you know, erectile issues and female sexual problems. And if we get the blood flow to improve, that'll help us. So this formula helps improve mental clarity, enhances mood, stress management, faster recovery, better heart health, better blood flow, effective methylation, which is a big deal. And I will teach you, we'll go through some classes on that together. It reduces cellular inflammation, which is a big deal. Most doctors will tell you that's the root cause of all sickness and disease on the planet. So that's our cell signaling formula. How many of you think that's pretty cool? Yeah, that's a big deal right there. Okay, so I want to cruise through this now. I want to talk a little bit about your microbiome. Now, I promise, like I could do a whole weekend just on microbiome. We could do a whole weekend just on DNA. We could do a whole weekend just on cell signaling.